Glucagon is secreted from the alpha cells of islets of Langerhans. It has several functions that are opposite to that of insulin. Normal fasting glucagon concentration is around 100 to 150 picograms per ml, and its metabolism is same as that of insulin. If you see the actions of glucagon, glucagon is glycogenolytic, gluconeogenic, lipolytic, and ketogenic. It favors breakdown of stored nutrients. On carbohydrate metabolism, glucose increases the blood glucose level by stimulating glycogenolysis, where it increases the breakdown of liver glycogen to glucose, which in turn increases blood glucose by inhibiting glycogen synthase and by activating cyclic AMP formation via its action on G proteins, which in turn activates protein kinase, activates phosphorylase enzyme, which converts glycogen to glucose 6 phosphate, and liver phosphate is and glucose 6 phosphate glucose, and it acts on liver cells to activate phospholipase C and results in intercellular calcium, thus stimulating glycogenolysis. It also promotes gluconeogenesis. It promotes formation of glucose from lactate, pyruvate, glycerol, and amino acids by increasing the rate of amino acids uptake by liver cells. It activates the enzymes which convert pyruvate to phosphoenol pyruvate, which is a late limiting step. And it also promotes gluconeogenesis by increasing deamination of amino acids in the liver. On protein metabolism, it increases the transport of amino acids into liver cells. On lipid metabolism, it shows lipolytic and ketogenic actions. It increases the release of free fatty acids from adipose tissue and makes free fatty acids available for peripheral utilization. The lipolytic activity of glucagon in turn promotes ketogenesis. Other actions of glucagon include it inhibits secretion of gastric juice, it stimulates secretion of growth hormone, insulin, and pancreatic somatostatin. It increases the force of contraction of heart by increasing cyclic AMP levels. It increases the blood flow in some of the tissues like kidney. It enhances the bile secretion. In insulin deficiency or in glucagon excess, so there will be decreased glucose uptake, which leads to hyperglycemia, glycosuria, osmotic diuresis, and electrolyte depletion. And they lead to increased protein catabolism, which increases plasma amino acids, nitrogen increases the plasma amino acids, and there will be nitrogen loss in the urine, and they also causes increased lipolysis, which increases plasma free fatty acids, which also leads to ketogenesis and ketonemia. Ultimately, both these factors, they are going to lead to dehydration, acidosis, ultimately lead to coma and death. If you see the regulation of glucagon, the secretion is controlled mainly by the blood glucose and amino acid levels in the blood. The blood glucose level is the most potent factor, that is increased blood inhibits blood sugar levels, inhibits the glucagon secretion. And increased amino acid levels, that is increased amino acids, stimulates the secretion of glucagon. Thus, in this instance, glucagon and insulin responses are not opposite. Other factors like exercise, stress, gastrin, CCK, cortisol, beta adrenergic stimulation, they stimulate the glucagon production, whereas somatostatin, secretin, free fatty acids, insulin, ketones, GABA, and alpha adrenergic activity, they are going to inhibit the glucagon